And with that, I'm going to start with some introductions of the folks on the line. From the state of Michigan, we have Ben Gulker, Mel Lucy, and Melanie Sanford. From Virginia, we have Janice Derber. From West Virginia, Terry Vickers, Tammy Belmont, and Charlie Dotson. And from Puerto Rico, we have Janet Santana and Juan Aviles. And with that, I'm going to dive right into our first question so that we have time for audience questions at the very end. I'm going to go in alphabetical order. So we're going to start with Michigan and then Puerto Rico. You guys are on deck. So Michigan, you've used data matching across programs to identify households for outreach. Can you tell us a little bit about your process and what the end results were?
Yeah, happy to. I'll be taking this one for Michigan. Good to talk to you all today. So in Michigan, the Department of Health and Human Services, we're the agency that is administering LIHWAP for the state. We use an online system called My Bridges, and in Michigan we use MI for everything to do with My. So My Bridges is an online tool that we use. It's proprietary to the state of Michigan, and residents can use this tool to apply for benefits and get information and manage about the benefits that they receive through the state of Michigan. And they can opt into receiving text messages as part of this solution. However, LIHWAP is being administered differently than benefits that we administer directly through the department, in that LIHWAP is being not administered directly by the state, but actually sub-granted out to community action agencies, and our partner community action agencies are then administering LIHWAP locally. So in Michigan, residents can't just hop onto My Bridges and apply for state benefits for LIHWAP. They're going to their local community action agencies and applying for benefits that way. So we wanted to find a way to kind of bring the resources of the state to bear to make people aware of LIHWAP and help encourage people to apply, especially as we're kind of in the closing stretch, and getting as many people access to these resources as possible. So we took advantage of this tool that's part of My Bridges called MI Resident Outreach. And this is a proprietary platform that allows us to send up to 1 million text messages a day via this batch process. And for LIHWAP, we were able to utilize this resource and identify households that were categorically eligible for LIHWAP, because at DHHS, we have access to households who are receiving food assistance, SSI, state emergency relief, which is funded by LIHWAP, and cash assistance. And then we were able to kind of slice and dice by county, which is how our community action agencies have their service areas split up. So we were able to identify categorically eligible households who had opted in to receive text messages, and then communicate directly to them via text messages, via a text message that says something like, are you behind on your water bill? We might be able to help. Visit caa.org/water. And since mid-March, which is when we started just a little over a month ago, we've sent out several rounds of text messages as part of this campaign. And we have reached somewhere around just about 600,000 text categorically eligible households. And we've received a ton of positive feedback from our community action agencies who are out there serving people in local communities. So we've seen an uptick pretty significantly in applicants, and we're just starting to see some of the financial reports. We'll maybe talk about that a little later, but we're starting to see an increase in spending as a result of this as well. So we're really happy with what we're seeing and happy to be talking to you all about it today.
Thank you, Ben. That's great to hear. 600,000 text messages. Sounds like a lot of text messages to me, at least. And with that, now we'll turn to Puerto Rico. So Puerto Rico has one main service provider, that water service provider, that serves many of the island's households. Could you explain how you worked with that provider and what the benefits of doing so were?
Sure, Mitch. Thank you for the opportunity for Puerto Rico being here, able to explain this process. From our end, we do have only one water and sewer provider. The Department of the Family established a data exchange agreement between the only waterworks and sewer provider in the island. So Puerto Rico Aqueduct and Sewer Authority, in this case, it's called here PRASA. Spanish, this is a Spanish acronym that we have. The administration of the socioeconomic development of the family, in this case, called ASEP, which is the agency that administrates the TANF and NEP programs, among others. To comply with LIHWAP's requirements and state of plan objectives, ASEP established the following data exchange method with PRASA. In this case, we use TANF and NEP program participant list to identify the very low income and special needs populations, disabled elders, in this case, parents, households with one children. The second requirement that we have is that the data is sent to PRASA in order to identify if any of the participants within the list that we have has a debt. So with the provider, with the only provider. The third requirement is that once the data files sent to ASEP are reviewed, we match them with the PRASA, and they are returned to ASEP for final review and confirmation. The last requirement that we do, or method, in this case, after the data matches the files are confirmed by ASEP, we confirm them first. The agency sends PRASA an authorization to process the cases to apply the payments. That's our last method. So, what data do we exchange? In this case, ASEP requires to have the social security number, the full name, the physical address. In this case, PRASA do expect from us social security number to be matched, full name, physical address, account number, a status, balance if it's due. We also require to have a type of registry, simple number, account number, amount paid, payment due or date, transaction number, payment method, check number, route or transit, account number, and document number. PRASA, on the other side, they also expect us to receive the payment to be processed and apply to PRASA accounts. And the reports to the results of payments are applied. Yeah.
I want to add something, and this is Janet. Since we have just one provider, it's easier for us to manage and to provide information and to do the exchange. Also because the provider, it's what we call a, it's like a government semi-agency. So it's part of the, it's a public corporation. That's what I mean. And the exchange of information, it's easier because since it's a secure system, we are able to share the private information, the personal information of each participant, and it makes easier the exchange. And if we were to have another provider or a private sector provider, would it be more difficult because we will have to apply more security in transmitting the data. I just wanted to add up that.
Yeah. So basically what Jen is saying is the process is more easier because we do have those benefits. So on the question of how the data was exchanged, we do have several methods or phases. In this case, the selected participants, ASEP prepares a file that it includes the TANF and NEP program, most vulnerable participants, example, the elderly people, people with disabilities, parents with children, and then we do the data match. Puerto Rico Aqueduct and Sewer Authority PRASA receive the file from us, and then they match these participants with the accounts that have an outstanding debt. So basically, we do require to be matched. The pre-screening is another method that we do. ASEP verifies all the following information on the file. This the participant's debt shall not exceed the program budget. A payment threshold is established as well, and then the payment authorization goes on. We do.
I think we lost you for a second there, Juan and Janet. Can you hear me okay?
Transfer it to PRASA. The last process that we do is the payment process. So PRASA applies the payments to all the accounts eligible of these participants, and then we receive the report from PRASA, giving us the result of the applied payments. So our end in this result and this process will be, we do have a total of 4,583, 4,583,868.
That's the amount that was
Yeah.
distributed and among all the participants to cover their debts.
As well, we did benefit 11,246 participants as well, households. In this case, participants are 15,662 participants. So basically, this is our process that we do here in Puerto Rico. It has given us a lot of a very good result on what we're doing, and given the example that we do want the most vulnerable to receive these benefits.
It's pretty simple, our process. It's since they are 10th and NAP participants, because we receive NAP, we don't receive SNAP. So we select the most needed participants, and the process flows like Juan just said.
Thank you. Yeah, no, it's good. That was a good example of what a data match is and can be, especially working with a single provider. And I also appreciate the clarification that NAP is SNAP, just under a different name.
Yeah.
Thank you. All right. So now sorry, go ahead.
Less money.
Yeah. So now we will turn to the state of Virginia with Denise. And so Virginia has been reaching potential applicants through data matching also. Would you be able to tell us about how this looks in Virginia and how it's been useful to your program?
Okay, so in Virginia, I'll start by telling you that typically when we administer any of our assistance programs, they are administered through 120 local departments of social services across our state. For the LIHWAP program, we actually contracted with an outside vendor to administer the program, and that vendor is Promise Network. So if you hear me referring to Promise in talking about this, that's who they are. So we do 2 matches here in Virginia. The first one is that when a water provider signs an agreement to become a LIHWAP provider, part of that agreement is that they will provide information to us about their customers, and that information has to include contact information. The information is then submitted from Promise in a file, in a secure file, to our agency to match against our current LIHEAP recipients. If there's a match, then Promise can actually send a text message out to those customers to indicate to them, it looks like you may be eligible for the LIHWAP assistance program. Here's what the program is, and here's how you apply. If they don't match to that, then we also have some messages we can send just to tell them about the program. But like I said, if it does match to the LIHEAP recipient, due to the fact that we know our LIHEAP and LIHWAP rules are very similar, we do expect that customer would be eligible. So like I said, we'll send a text message to say, it looks like you'll be eligible. Here's how you can apply, and here's how you can find out. Then the second match that we do is actually a match to determine categorical eligibility. So if we have an application from an applicant, part of that application is a consent form that we had to get actually approved from our Attorney General's office that would allow us to confirm if that customer states they receive SNAP, TANF, or LIHEAP assistance, then that we can actually confirm that for Promise so that they will know that customer is categorically eligible, and they do not have to require them to then submit additional information about their income verifications. Generally, about 80% of our applicants now are categorically eligible, So that is really speeding up the process for us to be able to process these applications very quickly, because most of our applicants don't have any other non-financial elements that they have to provide verification for. So if you can confirm that categorical eligibility, then you can move that application through very quickly. So that has been the big bonus for us with doing the matching and everything. And I will say one other thing, I didn't mention this. In the matching, what we look at is name, address, and date of birth. We don't use a social security number because that was going to create a lot of security issues and things. So like I said, we have been very successful with using those 3 elements, or some combination of at least 2 of those.
Thanks, Denise. Yeah, that's a great example of the use of categorical eligibility. I think that's really interesting, and I'm sure you and the folks in Michigan have a lot of discussions to have too about comparing approaches. So now with the last sort of round of these first questions, I'll turn to West Virginia. And so West Virginia, you've been working with water service providers to reach households in need. Can you explain how your collaboration works with the successes that you have seen from this collaboration?
Yes. Our West Virginia Department of Health and Human Resources is the ones that process and see the clients in office and field office, and they're also the ones that sign people up for SNAP and Medicaid and other benefits. So a lot of clients are already known to the system. So we have a lot of all their information in the system. And so the clients can come in and get LIHWAP processed the same day and payments sent out the same day to the utility vendors. We do have 462 utility vendors. And I have sent out contracts to all of the 462, and we've only received about 162 back from the clients or from the utility providers. But we also use a voucher. Tammy, could you tell them a little bit about the voucher?
When we were developing our system and we kind of had a short turnaround time to get it in process, we actually use a voucher for our LEAP program and emergency assistance program. For LEAP, it's for emergency LEAP. The voucher actually has a vendor agreement on it. So if we haven't had a vendor agreement signed by a water provider and we have someone in an area that we haven't, maybe they haven't turned theirs in, by signing that, they're actually completing a vendor agreement. So it makes it easier for us and also for the client to get their payment, and too for the vendor. So that was kind of how we came up with that. So it kind of streamlines the process. Terry, I'll turn it back to you.
All right. So after we have established the contract with the vendors and spoke with the vendors, we have sent out flyers to numerous organizations telling about the program. And I have made it personal where I call utility vendors and check to see how the program's going. I have given my direct contact information. They can email me anytime and I always respond within that day. If they have any concerns, issues, or if they have a client in need, they can contact me and I can contact the client and set up an arrangement for the client to be seen in their local DHHR office. Or if they have a disability, we're ADA compliant where we can send a caseworker out to their home to complete an application and get services.
Thank you. Yeah, that's a good overview of the approach. Is there anything else anyone from West Virginia has to add before I move on? Tammy or Charlie? All right. So I think we'll move on to our second round of questions, round robin style. So I'm going to go in the same order that we just did. I'll start with Michigan. What feedback have you gotten from community action agencies about your approach?
I'll take that one for Michigan. I'm Mel. I'm with Ben and Melanie. I work there with them in the Bureau. So we've actually received very positive anecdotal feedback from the community action agencies about increased interest from the text messages. They are getting more phone calls, more applications, We've also had a slight increase in our vendor agreement since the start of the text messages as well, which is huge. A couple of examples from the feedback we've received is I just checked with my team. We're already seeing an uptick in responses, and that would be the day after the texts were sent. So that's wonderful. Another example is just FYI, the robo-texts seem to be helping. They've been much busier on this grant in March than we were for prior months, which is also wonderful. And then another one is just thank you so much for coordinating these messages. We're getting a great response. So they're very appreciative of it, and they're definitely seeing an increase. So that's wonderful. And we do know how many successful text messages and households that we've reached out to, but we don't have a quantitative data beyond that point yet. We are a cost reimbursement state, which means our CAAs spend the money up front and then they submit their reimbursement requests. And then we have seen increases in those requests for March. We just don't have the data of that yet. In addition to the hard work our CAAs are doing around the state, our agencies have let us know that the text messaging outreach has definitely helped with that.
That's great to hear. Thank you. That's a good example of I keep saying good examples, but these are all good examples of how action at the state level can also trickle down and assist with the community action agencies. So that's really good to hear. Now we'll turn to Puerto Rico. So could you explain for us why did you use TANF and NAP or SNAP for those non-Puerto Rico to determine who would receive a benefit? Could you just talk about that process, how you came to that decision?
I'm sorry, yes, since we decided to use TAN and NAP, we're close to 4 million people here in Puerto Rico. So what we did is we tried to select the most needed population, and those were the ones that are the NAP and the TANF participants. So and obviously these people had unbelievable, had greater and their depth with the water company and provider was pretty high. So what we did is we selected those participants that really needed, and most of them had zero income. So we were trying to help them out, and obviously the water company helped us in selecting among all those in the data exchange, which were the ones that had the higher depth. So and so we selected those versus the highest need, the greater need. So and that's what we selected, because obviously the amount of money, the grant wouldn't be enough to it would be great if we had some more so we could spread it out, but that's why we just chose TANF and NAP participants.
Thank you. Yeah, that's a good point, that based on just costs and benefits, just sort of reaching the folks who are in need of assistance. Makes sense to me. Yeah. Who are there. So Denise, will now turn to Virginia. How do you deal with providers who maybe don't want to provide you with customer information? These are the water utilities.
With our state, as I said, our Attorney General's office advised us that we have to have a vendor agreement. We cannot make any payments without that agreement signed. So part of that agreement does explain to the water providers the customer information that we will require from them to be able to make payments to their customers, and exactly what we'll do with that. So we try to be very clear to them that, we are only using this information for LIHWAP purposes. We're not sharing it outside of anything else, and we're not sharing it, even within our own agency for any other program. Generally, once they read through the agreement and everything that is there regarding, the minimum information they have to provide and what we'll be doing with it, they are fine with it. However, if we do have anyone that is questioning it, we can then also have them look at our other vendor agreements for our LIHWAP program and explain, that this is something that we've done similar data sharing and haven't had any issues with it in the past with those vendors. Sometimes that will make them feel better. And then one of the things that we've done too is Promise Network is very good with working with the providers to help them to get the information that is needed in a way that they can submit it to us securely and that we can respond back securely, so that they're very sure that everything is, everything that's being turned in, like I said, is a secure data exchange. They know exactly what's being done with this information. And we also have been able to try to make clear with them some of the first providers that we signed up for the program, to let them talk with the newer providers or the ones that are interested in being a provider and just really want to talk to somebody about, what's been your experience with this program and what they do with this information. So all of that has been very successful. We've had very few that have basically then not decided to participate.
Thank you. Yeah, no, that's good to hear that, sometimes the best advocates are the folks, working in the program themselves, the other utilities talking to other utilities, and that makes perfect sense. So finally, with this round, West Virginia, could you explain the differences between how you have been collaborating with the larger providers versus the smaller providers when it comes to your approach?
There hasn't been much of a difference with our smaller providers. We've got a lot of small providers, and we've only got one big, huge provider, and that's West Virginia American Water. And we have got a contact for West Virginia American Water, and actually she's just like down the street from me, and we work very closely together because it is such a large provider. But they have been so personal, and we work so great together and provide information and help each other. I was in an issue one time. A smaller provider didn't want to wait for our payment, didn't want to sign our voucher, and didn't want to install somebody's turn somebody's water back on. And the West Virginia American Water contacted that smaller provider, explained what all they do to process it and how they get their payment with us, and kind of reassured them, and that kind of really helped us with the smaller provider. But most of the time we have a good relationship with a smaller provider because we have used emergency assistance with them in the past, or another program that we have used for water assistance. And we've developed a little bit of a relationship with our water providers before this program began.
Got it. Yeah, that makes sense too. Thank you for that information. I think before we turn to audience questions, we'll do one quick round, not a lightning round, just a quick round of a third question for each grant recipient. And so we'll start with Michigan and then move on to Puerto Rico. So Michigan, how easy was the exchange of information for you? Was this something that was difficult to set up for your LIHWAP?
Sure, I can take this question as well. So actually the process has been very user-friendly. We receive updated list of opt-in clients from the data warehouse section of MDHHS about once a month. The lists are protected due to the information they contain, and they're saved on a secure server. Each month we break the list down by the counties that each community action agency serves, and then we narrow that down to the phone numbers only. The spreadsheet is then uploaded into the text message system, as Ben mentioned earlier, MyLogin MI. And that includes each of the CAA's unique contact information and the messaging that they've chosen and had approved. From there, the texts are automatically sent at a rate of 30 text messages per second, 1,800 messages per minute, and 108,000 messages per hour, which is super cool. The day after the messages are sent to each service area, we receive a confirmation of how many were successful and how many bounced back as undeliverable due to multiple different reasons. We then share this information with the community action agencies, and then we verify that they're interested in another round being sent in 2 weeks. The original messaging was approved by the Department of Health and Human Services Privacy and Compliance and the communications offices. Texts are limited to about 160 characters, which has been challenging, but we've been working with our agencies and it's worked out really well. And the system, they will not send them between 8 p.m. and 8 a.m. So we've been scheduling the campaigns to go out around 9 o'clock in the morning. That way we're not waking up a bunch of clients at 8 a.m. in the morning. And we, so that ensures enough time that way they're all sent out and we don't run into any delays.
Perfect. Yeah, thank you for that explanation. It's helpful to hear how the process, you know, goes from start to finish. Next for Puerto Rico. So your data matching method could also be implemented by other grant recipients, for example, other territories, tribes, and states, or folks who have one main provider. What is your advice to those grant recipients about working with one main provider as opposed to multiple different ones?
Well, in our case, as you mentioned, Mitch, it was really easy to establish communication with the only provider of water here in Puerto Rico. We did establish an agreement with them. It was only communication as well. The process was easy because we only had the list of participants from TANF and PAN and NEP. No registry was used for those participants that were interested to apply to these benefits. So it was really easy for us to do it this way. Jenny, you want to add something?
Well, if you give it advice, it's kind of obviously for us, I don't know if everybody will have the same situation. I know that we are kind of unique since it's a public corporation of the government. But definitely using our list of TANF and NAP participants was make everything easier, because these are participants that they are already in the system, and we don't have to create a new profile. So we didn't have to create a new registration or any kind of, I guess, that the rest of the states had to do. So for us was really easy use this database. So if they have the database on these programs, try to address, at least target the benefits first for these participants, because it's going to be easier, the data exchange among both.
Yeah, thank you. No, that's also another good advertisement for categorical eligibility when it comes to things like TANF and LIHWAP and other categorically eligible programs. So for Janice, we have I think you actually talked a little bit about this in Virginia, but could you just go over what specific data points are used to identify households, and especially maybe even with a lens towards privacy and data sharing concerns?
Yes, we use, as I said, name, address, date of birth. We can, when we're looking for outreach purposes, we are typically looking at all of those elements. And for the address, a lot of times we will be able to narrow it down to not a full address, but like the first 5 characters of a street name or something of that nature. I will point out one of the issues that we had in the beginning was of course, the providers don't enter their information in the same format into all of their systems, and their format may not match the format that our eligibility system contain the information in. So that was one hurdle we had to cover early on. Was when we did our first matching, we were getting percentages like 6% matches or something. And we were able to go in, look at individual matches just to determine, okay, is it because the street is abbreviated in ST instead of the word street spelled out, or, you know, what's the difference there? So that is one thing I will say with the data matching. Sometimes in the beginning, you do have to tweak it a little bit to make sure that the 2 pieces of information or the 2 sources of information that you are able to actually match those. For the categorical eligibility, the same thing, we're using name, address, date of birth. And for that, as I said, we can actually consider it a match if we are getting 2 of those elements to match up. For the privacy concerns, again, we do have the consent form that we have the customer to sign to say that we can do this match and that we can provide this information back and forth. We do all of this through a secure file transfer process to make sure that there's no way that the information is actually not secure or encrypted when it's exchanged. And one of the things too with being able to use simply maybe, like I said, the 5 characters versus an entire street address or something is it helps with being able to look at, you have the information, you don't have to be as concerned with it's now the customer's full information that's in that file or something. So all of that, like I said, we've tried very hard to make sure that for our security purposes and also through confidentiality and things of that nature, that we were checking all the boxes, that we were not going to be sharing any information that we didn't have explicit permission to do so, and that we were doing it very safely.
That's great to hear. Thanks, Denise. And I'm obviously sure that the clients, the households appreciate that their data is secure and safely managed. So now for West Virginia, this is sort of a question that cuts right to the root of your approach. Why do you think so many providers have been comfortable reaching out to you? How come folks just feel like, I don't know, they can talk to you?
Well, it's because of my bubbly personality, of course, but no, I have made it like a personal goal to try to contact providers and make them at ease. And if I haven't got to contact them, their neighbor from another county, I'm sure from a utility provider, has spoke with me, and they all speak amongst each other. And they have told them, hey, if you have a question, contact Terry. And my direct name, my number, my email, all the information is on the contracts that I send out to everyone. And when they do call, I'm very quick about responding back to them and answering their questions and helping them with any concerns. So I've kind of made a personal approach with them, and we all kind of lean on each other, and we just try to help everybody together and just work together to make this program awesome.
Thank you, and you definitely do that. So we appreciate all the work that you all are putting into LIHWAP for your communities and for the nation as a whole. So before we're gonna now turn towards audience questions, and I want to thank you to our participants for sharing with us how they've used data just from these outside sources, from different utilities across different programs to reach more people through LIHWAP. I think that these are good examples of data matching, and they'll be very helpful to the other grant recipients on the call. So with that, I'm going to turn it over to the, well, not turn it over, but I'm going to open it up to audience questions. Please feel free to throw them into the chat. And also, if you'd like to raise your hand, I can, you can go off mute and ask your question virtually face-to-face, whatever your preference is. I did see a question in the chat while we wait for folks to formulate their questions. So someone asked, New Hampshire does not have in their contract that we can pay for clients enrolled in SNAP or TANF. We can only enroll clients that are enrolled in their fuel assistance program. That sounds like some sort of LIHWAP local program. How are states getting this approval, and how long does it take to obtain approval? That's a good question, and I can actually answer that, hopefully, off the bat, which is that, so the categorical eligibility, SNAP, TANF, LIHWAP, certain means-tested veterans programs, things like that, those come down to the state's implementation plan that was submitted to the federal Department of Health and Human Services. And so if the state, if you're coming from, say, a community action agency, you can, talk to your state administrators, request that they update their implementation plan to include, in this example, SNAP and TANF. And that way it can be just sent to HHS here at OCS for approval. And then from any household from then on that is enrolled in SNAP and TANF, they can be categorically eligible for LIHWAP. So I hope that answers your question in the chat. And while we wait for other folks to sort of come up with some questions, we did have one that was submitted via the registration. And someone would like to know, how can we manage the privacy concerns that come with sharing customer data? I know Denise and Virginia, you've sort of already answered that. Does anyone else have any insights into working around privacy concerns when it comes to this personally identifiable information or other aspects of privacy and concerns, security? If not, I think that Denise, your answer was also helpful to talk about, some of the information is not necessarily like a whole social security number or a full address. And I think also in I think Terry, you were saying that it was just a phone number and a name, right? Is that correct?
Yes, if I can just get their name and a telephone number, they don't have to give me any other information, and I'll contact the client myself and speak with them about the services we offer and direct them to where to go to apply, and just try to help them and let them know what verifications they need to go to the office and get assistance with. So I just need the basic information that you can even get off of Google. So it's nothing too private, just the basic information.
Great. Okay, that's good to know. Thank you. I'll pause here for a sec if anyone wants to, in the audience, has any questions they'd like to throw in the chat. We have some thanks already rolling in, so that's good. I'm glad to hear that this is appreciated by the attendees. And if there aren't questions from the audience, I'll actually turn it over to the panelists. Are there any questions that you think that anything that we didn't cover that you'd like to mention about your approaches to data matching? One, and two, are there any questions you have for each other about how the approaches worked in these different states and territories? So I'll let that sort of ruminate if folks want to think about anything that they want to mention, any success stories that they want to shout out from your approach as well.
I just want to add that the benefit of having using our TANF and our SNAP IMNAP program is that we were able to like 60% of our participants are people 60 years old and plus.
Mm-hmm.
So it's a big population under that has a lot of needs. And the second population more represented that was children between 0 and 17 years old, obviously because they are within a household that receives the benefits. Also that 64, I think it's a little bit higher. There's a high percent, most of the participants are women. Head of household, that's a 65.48% of our participants that receive the benefits. So being using these two programs gave us a lot of opportunity to provide assistance to these households that are in more need, like elderly and women with head of households.
That's great. And it's great that you have that data, those numbers to back up that, it's reaching the folks in need, the folks who maybe have a great vulnerability or a great need for assistance. So that's good to hear. Thank you.
I would just like to say, just build a good communication relationship with your utility providers. And if you have any questions, lean on them and let them lean on you, and just build that good line of communication, because that's what's helped our program succeed, is communicating back and forth and assisting clients.
Good advice. Yeah, thank you, Terry. I appreciate that. And so I think since we're not getting questions from the audience that folks are asking about, I think we can sort of start doing wrap-ups. So I think in order, we'll go down alphabetically as we've been doing. If folks just had any last words of wisdom, any words of motivation, maybe, for folks on the line who are looking to implement some of these approaches that have been mentioned today. And we'll start with the folks in Michigan, if you have any parting words.
I don't have anything other than to give a big shout out to Mel Losey, who's been doing so much of the hard work getting these text messages out and making sure that residents in Michigan who can benefit from this valuable program are getting service. She's done a lot of the heavy lifting for this, so I appreciate her and her efforts. And thanks to our partners in the federal government for making this program happen and for inviting us to be part of the webinar today.
Great, thank you, Ben, and thank you, Mel, for all the work that you've put into helping the folks in Michigan. All right, so now we'll turn to Puerto Rico. Any parting words?
Yeah, thank you, Mitch, for the opportunity as well. I would like to thank Carlos Torres. He was one of our specialists on this work. We also we do value these benefits for the participants that are receiving it. We definitely know that they need it. So as well as we said before, if it's possible to be expanded more benefit, that will be great as well. So thank you.
Of course, and I think you're not alone in that sentiment at all. Denise in Virginia, do you have any parting words?
I would definitely echo what Michigan and Puerto Rico have already said. And I do appreciate the opportunity to speak with everyone today. I will, just reiterate, I do think establishing these partnerships with the providers is super important. I know our program got off to a very late start, but initially we were working with a work group of water providers across the state just to find out, what their billing systems look like, what their communication looks like, all that kind of things, because in our state, we've never even had a statewide or region-wide water program. So for most of us, establishing those relationships is something brand new. So I definitely would encourage everyone to do that. And I would encourage, also HHS to continue to try to foster those relationships and everything too, because I think this program has definitely been able to validate the need for a program like this to continue. And I certainly hope that we can see it continue in the future.
Thank you, Denise. Yes, I think that's also good points, and really highlighting, of course, that this is, for a lot of us, 2 years ago when this program was first, authorized, this was uncharted territory for a lot of folks, and definitely the hard work over the past few years is much appreciated and much needed to continue into the future. All right, West Virginia, do you want to close us out?
Yes, I was fortunate enough that when the program was developed, I was not working here yet. And Tammy Belmont and Charlie Dawson are the ones that worked hard with getting the data system up and going and running and all the applications and everything developed. All I did was come in and just be the mouth and do the interviews and the talking and the communication, and because I do like to speak. So I've just been the mouth, and we've all worked hard together and pulled it all together. And if y'all have any questions or anything, you can email me. I'll respond back pretty quickly with any questions that anybody might have. And thank you for having me on the webinar today.
Of course, thank you. And with that, I think we can wrap things up for today. Thank you again to all of the panelists, the folks in Michigan, Puerto Rico, Virginia, and West Virginia. And thank you, of course, to our audience of grant recipients and people implementing LIHWAP on the ground. We also appreciate your work and everything that you're doing to make this program such a success. So thank you to everyone, and have a nice rest of your day, rest of your afternoon. And with that, I think we can close out. Take care, everyone.